Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. Well, if I sound a little nasally, I apologize because the last week or so, in particular on Thursday and then into Friday, I was down for the count. And apparently that's going around. And so if that's true for you where you live, stay healthy and maybe avoid the school systems or something like that. I've heard local schools in Colorado where some of them were like canceled because of how many teachers are out. So there's stuff going around. In that same thread, we're going to talk about going to the doctor. And we're going to talk about how to advocate for yourself as a headache or migraine sufferer, trying to navigate our healthcare system. How do you advocate for yourself in the doctor's office? We're going to talk about what questions to ask your primary care or neurology visits at your primary care or neurology offices. And then we're also going to talk about when you're in the alternative realm of providers, what should you look for? So we're going to lay out I'm going to lay out basic principles to follow as far as, questions to ask and things to look for when navigating our healthcare system. And hopefully this podcast is again, very helpful and practical. Okay. So we're looking to educate and empower. If I were you, if I were stepping into your shoes and I had your symptoms and I was trying to navigate my own health through our healthcare system, these are things that I would do. Okay. Some of these things may highlight a lot of the problems that we talk about on this podcast. And so some of them may be insightful as you ask the question to your provider. You may already kind of know what the answer is, especially if you've been listening to this podcast for a long time. You probably know what the answer should be. It'll be interesting to hear what your provider says. So taking this information and these questions, if you go out to your providers and you ask them the questions, I'd love to get your feedback and hear what providers are saying. And so if you email us at hello@noveraheadachecenter.com and let us know what your provider said when you ask them these questions. Let us know if you have a really good provider that's been fantastic and is in your area locally, and maybe you don't live in Colorado. We would love to build resources for other people if there's good providers near you. And so please let us know. Let's make this interactive. Send us an email, hello@noveraheadachecenter.com. And for those of you who don't know, the Headache Doctor podcast is hosted and functions out of Novera Headache Center. That's our physical location in Colorado Springs and Parker, Colorado. And so for a lot of you listeners that are not in state, that are not locals, when you're thinking about flying out for treatment, that's where you're headed, Colorado Springs or Parker, Colorado. That's Novera Headache Center. And we've been open, this is our 7th year. So anyway, we've seen just about every type of headache and migraine. And so we've had just about everyone we see gives us their history, and with that includes like their interactions with primary care neurology and kind of what they've seen or heard. And so a lot of this specific podcast is going to be taking what the themes of what I've heard and then saying, okay, this is what I would do in this scenario to help advocate for yourselves. The goal of this, like the end result, is to try to push providers to think differently, and then also to allow them to help you in a greater capacity. Oftentimes, excuse me, there you go. I'm still recovering. But oftentimes in our healthcare system, providers get stuck in this, like they're a one-trick pony. So, and that's specifically with medication. And patients often are wanting something outside of medication. And the medical doctors in particular are all very, very smart. And they all have resources available to them outside of medication. We just might need to push them to think differently about the situation. All right, so first off, principles to follow. All right, so you want to find the right doctor. This is key, all right? We're not going to fit a round peg into a square hole. And so we want to find the right doctor. These questions are going to be effective with the right doctor. And this conversation is going to be effective with the right doctor. If it's the wrong doctor, it's just going to be dead end after dead end, okay? So before we even enter into like the conversation that we're going to have, we need to find the right provider. So what do I mean by the right provider? The right provider, and I'm primarily talking about the MDs right now, but there's going to be a similar framework around the alternative providers as well. Like this first characteristic of a provider is true for both alternative and then like the traditional. So they will ask the question why, and they will be humble. All right. Now that's something that you want as a standard. You want your provider to ask the question why, and you want them to be humble. Now, there's different types of providers in our healthcare system. Think of like the orthopedic surgeon who is super confident, they've never made a mistake in their life and they know the answer to everything. Now, that's okay. You can have a surgeon, you can have an orthopedic surgeon that's super confident. And in that realm, I think that functions, that works. In the realm of headaches and migraines, especially when you're an MD, you really shouldn't be working in an environment or with a sense of confidence that like everything that's happening, okay? And largely because the training that medical doctors have is, you can look it up. It shouldn't take too long. Johns Hopkins, Mayo Clinic, these leading institutions, their websites, which are a reflection of like the leading neurologists that would come out with a statement on like what is a migraine, will largely say that we don't know, but here's sort of what is happening in the brain. And so they would say it's a spontaneous neurological event. They talk about the chemicals that are involved, serotonin levels, things like that. But to ask the question why, like if we keep asking the question why, they really shouldn't say, oh yeah, I know exactly why. And we're confident in this, and we don't need to do any more necessarily like research. Like we know why. So they shouldn't be saying that. And so they need to be curious, because when you're entering into a situation with a patient and you don't have the answer, and your training hasn't set you up to be able to help understand and resolve the why behind these symptoms, then they need to be naturally curious, and they need to be humble, because that curiosity and that humility will allow them, let's say, okay, they've had hundreds of patients before you that presented with similar headache or migraine symptoms. Now, what it'll mean for you is that if you found a provider that's humble and able to ask why, let's say, a few dozen of those people, of those past patients, have come and said, hey, I have this chiropractor in town, and I've always felt like it's my neck. And when the chiropractor worked on my neck, it seemed to help. Or I had this massage therapist that did this stuff on my jaw. And when I had, this specific type of pain, like this jaw stuff really helped. Or, hey, I realized that if I like clean up my diet and I start eating well, then my migraines substantially reduced. It could be any number of things. Or if someone said, hey, I've exercised, I've really started to take care of my health and move more, and it really seems like my tension headaches have dropped substantially, okay? So things like this should be popping up in these providers' ears. And if they're curious and they don't lead with, well, I know what the problem is, and so that doesn't really make sense, and so I'm going to ignore that. And instead they say, well, that's really interesting. I want to learn more. Tell me more about that provider. Tell me more about what you did. And I'm going to start implementing that with my patients, okay? So unless this provider is fresh out of school, they should have some experience with people like this, and you'll see the humility and the ability to ask why when you talk to them, okay? And they'll talk about patients with past experience, and they'll say like, oh yeah, I've had people find success with this. That's a level of humility because that's not them. They're not the hero in that scenario. They're guiding you in actually a different direction. It's not towards their medication or their Botox, but they ultimately know that my medication and my Botox is not the thing that's going to like help. It's symptom management. And so if you have a provider that's that has enough humility to admit that, that's a good provider, and that's someone you want to work with. Yeah, they will say they don't know why. If you have someone you're interacting with, a provider you're interacting with, and they say, yeah, I do know why. And it's just because whether it's, I don't know, serotonin levels, or there's a chemical imbalance, or it's a spontaneous neurological event and we just need to manage it with medication. That's a yellow flag. Like you don't want to, that's a sign that they don't have that like curiosity, humility to keep pushing. Because the latest and greatest medication is only 50% effective for half the people that take it. So it's like you clearly aren't getting to the why behind this. And then the people that find success are likely dealing with side effects of the medication. And I mean, it's not as if we're like, and they just have to keep taking it. Fundamentally, I believe we live in a world that you don't just have to like take medication for the rest of your life. Like we're not born with this inherent need that we just need medication. Like our body had some void of something and we're just needing medication to cover that up. There may be like one-off scenarios, sure, like random things, but like by and large, the majority of people, and headaches and migraines are very, very common and prevalent. It's the number 2 most disabling disease, quote unquote disease in the world. Okay. So it's not as if all these people are just like born and like lacking serotonin and then like their body goes haywire once a month or every week or something. That's not what's happening. If someone says like, yeah, that is what's happening and like full stop, period, that's not, we need to maybe find a new provider. They're open to alternative approaches. Like I said, if they've heard of other people finding success with whatever, whatever it may be, acupuncture, massage, diet changes, increasing exercise, doing yoga, they'll hear those things and they'll be open to those alternatives and they'll actually encourage you to try them. They don't have to be the expert in those things. They definitely don't have to be the expert in those things, but they just have to say, hey, try this, try that. I've heard it helps. Okay. They come to you with solutions outside of medication. And so I think they should lead with this, but even if they're not leading with non-medication solutions, so if they're not leading with it, like if you have to dig or ask, it's probably a yellow flag. But I think if you ask and they're at least like open to engaging in that conversation and trying to problem solve outside of meds, I think that's good. If they're not, then yeah, we need to find another provider. I think our healthcare system, I've heard some horror stories of patients that have interacted with neurologists that are, it's just really awful. And I don't know, like I have to believe these neurologists are in it to really help people, but have just been, I don't know, beat up. They don't have the tool that's really fixing the headache or the migraine. And so people get kind of frustrated. They want a non-medication approach. Neurologist doesn't have it. So they just sort of get fed up and frustrated. And I think sometimes that leads to a callous and heartless, emotionless type of like interaction between a provider and someone with headaches and migraines. But we want someone who has that curiosity in them that's saying like, I don't know, but I'm going to try to find out. And they go on their own journey, just like you are on this journey and you found this podcast, right? And so the information is out there, albeit it's not front and center, but if you're curious enough and you really care, you can find alternative solutions. And again, we're like Novera Headache Center, although we're hitting a specific component of headaches and migraines that's largely overlooked. It's not like we're the only thing that's going to help people outside of meds. There's lots of things that can help people outside of meds. And so the physician just has to do their research and understand what those are to be able to help their patients. Okay. So those are kind of principles to follow when you're finding a provider. And then the questions, well, let's talk about alternative providers before we start asking questions. So when it comes to alternative providers, there's a few sort of separate things that I would watch out for. Okay, when you ask the question, what do you believe the problem is? I would say be cautious with providers that have a one-size-fits-all answer, okay? Now, I hope listening to this podcast, you guys realize like we are huge on the neck, right? Like neck, jaw, shoulders, like there's an overlooked neck issue, and you having head pain is kind of like you saying, hey, I have a knee pain, and me saying, well, I think your knee has a problem. Like there's a one-to-one relationship, a direct relationship between the head and the neck. And so we have to assume the neck has something going on, all right? So now what we don't do here is say that's the only thing that could ever impact this, and if it's not the neck, then we can't help you. No, we don't say that at all. We say that like systemically, it's really important that your overall health is good and that your inflammation's reduced and that you're eating the right foods and that your hormones are balanced, because if those are all out of whack, it's going to be really hard to tolerate any sort of sensitivity in your neck. And we also say like you should be sleeping well, and you should be able to breathe through your nose, and you should have a tongue that functions well and isn't tied down and isn't causing a lot of restrictions and tension. So we understand these other components of the body and how it impacts your overall situation. As far as our treatment, though, of course, like we want to treat the neck. And so providers can have their specialty, but when they look at the framework, when you ask them to zoom out and look at what are all the things that can impact this scenario, you want an answer that's more holistic. And so a couple of things to watch out for. And sometimes this is, I see probably this more in chiropractic offices where it's like, well, your neck is slightly off and the alignment isn't quite right and your atlas is shifted. And that's the whole reason like all of this stuff is happening. I mean, you're going to get cancer in 20 years and you're going to have degenerative disc disease and scoliosis and you're going to get, it's just like amazing the things that they'll tie to like your one bone is off by like 3 degrees and you need me exclusively to fix it because I have some special tool in the back that no one else has in the world, and look at the certification on the wall. Okay. Like I'm tired of that stuff and I don't love it. Let's stay away from like the only thing in life, that is causing headaches is this thing, and I'm the only person that can solve it. Okay. Now, it's funny because you may be like, well, that's kind of what you're saying, which the difference is in if we are, and I'll roll this into the next question, but when you ask someone, like, what does it look like to make progress through their system? If they're saying, okay, like, I'm going to have you sign on to like 30 visits and progress is going to be like that bone shifting over. And so we're going to need to take repeat x-rays and I'm going to need to tell you if you're improving. No. We want to talk about symptoms, and we want to talk about you actually feeling better. And we want to make sure that you're feeling better, like as we go, right? And so you want to evaluate your progress through whatever treatment it is, whether it's functional medicine, diet changes, working with a chiropractor, whatever it may be. You want to be able to evaluate your progress yourself, okay? Don't rely on them to tell you if you're getting better or not. Now, a provider can have a clinical evaluation that gives you objective, like, hey, here's things that I see that are improving, and that can be helpful. But if you're not getting better, I wouldn't like be on this long drawn out journey of like, oh yeah, it's just right around the corner. We just need to do this other thing and take this other x-ray. No, like you should be feeling better. So for example, like if the thing is taking their one specific branded supplement and like that's it, that's another like yellow flag. So really we want to zoom out. We want providers, like we talk about on this podcast, we want them to talk about the holistic things, like move more, exercise, eat the right foods, sleep well, improve sleeping position. We want you to, and then they can provide their specific intervention like we do, But overall, we want them talking about like general health and wellness, because these principles are true. And we're not going to find a scenario where like providers hit at specific levels of these principles, but if they miss the forest for the tree, we want to be a little bit cautious of that. I hope that is clear in what I'm saying. I feel like there may be a little bit of confusion in how I explain that. But the principles are, when we ask them what they believe, we don't want it to be one-size-fits-all solutions. Again, they can have their specialty, of course, just like we do. But we want them to draw connections between like general health and diet and exercise and sleeping. We want them to draw all of those connections together so that you feel empowered to do something on your own, not just completely rely on them. You can ask them the question like, what other providers do you work with and find helpful? That's a good indication that they are not just like a one-size-fits-all. We are the solution for everyone. Just like we refer out for airway specialists or like gut health issues, or if you need your hormones balanced, and these things are really important. And so we work with these providers. And then also, have you helped someone like me? I mean, you're just trusting that they're answering this question accurately, but I would ask this question and see how confident they are. Especially in the physical therapy world, I would say that a lot of PTs, for you, the listener, if you go ask them, have you helped someone like me? They may be not so confident with this. If you find a PT that's super confident, it's like, oh yeah, I do this every Tuesday. My afternoon is only headaches. Like that might be someone you want to pay attention to and listen to what they're going to say. Okay. So there we go. Those are the alternative sort of potential traps and how to avoid them. And then finding, again, just a provider that's humble and asks the question why and is willing to use other providers and can zoom out and look at the whole picture as opposed to just their one specific solution. Now, a lot of the providers we work with, well, all of them, of course, think that the solution they're providing is like the main reason, the main thing, right? And that's okay. Like, I mean, we focus on the neck more than, Dr. Goals focuses on airway. He's going to think, well, oh, this is an airway issue. And I'm going to think, oh, this is a neck issue. That's natural. But like we work with Dr. Goals because he also realizes like, yeah, the neck is an issue. And I realized, yeah, the airway is an issue. And so you want to find providers like that, that aren't just like closed off to anything outside of their one approach. Okay. All right. So what are the questions to ask? So one of the first questions would be, like we talked about, what are non-medication solutions that you have seen work with your past patients? Okay. Again, this is humility for them to give you an answer that's not like them. All right. So you're basically asking, what are things outside of your control that you've seen that are helpful? If they're like hesitant to like jump into that, that might be a yellow flag. Or if they just don't really have any answers, like that could also be a yellow flag. But you want to push them to try to find those solutions. Okay, what types of providers do you refer to help you manage headaches and migraines? That's another good one. If it's just like, oh, I send to pain management if, it gets out of hand, which is just like injections. Like it's just injections of different, steroids and things like that. So that's not the answer we're looking for. We're looking for things like, oh, I send people to an acupuncturist, or I send people to this really good massage therapist, or those sorts of things, like real things, not just like another provider that provides a different medication. I would ask if you're getting prescribed a medication, know the side effects of the medication, and then ask when you're at risk of medication overuse or like a rebound headache, because yeah, they're likely not going to just offer that up. Potentially they are, but I would know what you're putting in your body and what the risks are. Oftentimes I guess I haven't been prescribed too much medication in my life, but just the way our healthcare system works, like informed consent, it's almost not a thing. I mean, like, sure, we're all like signing stuff that has so much fine print, like no one ever reads it. So we're not actually informed of what we're doing to ourselves. And so just ask the provider to actually tell you, like, hey, let's spend the time. Like, tell me all the reasons why you think this is going to work, what it's going to do to my body, What are the side effects? What are the harms involved? That way you're actually informed. Ask them, can the neck refer this pain into my head? That's a big one, and I would be fascinated to know how they answer it. So if you ask your provider this and email me, kudos to you. I'll probably send you a coffee. We can do that via email. Not the actual coffee, just a gift card. But if you ask your doctor that and then send me an email, can the neck refer this pain into my head? I would be fascinated to see what they say. I actually have no idea what kind of response you would get. I really don't. I would hope it's like yes, but I don't think it would be yes because likely they would say, well, we can take an x-ray and we can look at your neck, and if there's a problem. I don't think they would give you a direct answer, but it would be interesting. So ask that and see what happens. If they say yes, then it's like, well, who can I see to help me with my neck? And then they'll say, well, there's this place in Colorado called Novera Headache Center, and you should go see them. And then you and the doctor will both get gift cards to coffee. Okay, what is the role? Ask them, what is the role of exercise, diet, and proper sleep, and what suggestions do you have? So you're just asking them, like, what's the benefit of my overall health? Like, what's the impact of my overall health on headaches and migraines, and what suggestions do you have? So you're basically like rolling out the red carpet for them to like help you understand how to improve your overall health. Okay. And again, like if you've been listening to this podcast, you know that it's not as if like, oh, you just try to sleep better or like, you know, you move a little bit more. Like there's not like the magic pill is just around the corner and it's that simple. But it's doing the simple things, prioritizing your health, and laying this foundation so that your body can manage pain, and you're reducing the amount of stress through your neck, things like that. How does my diagnosis help me understand the underlying problem? And then is there anything objective that it's tied to? Ooh, here's another interesting one. So if you're already emailing me about the neck one, email me about this too. How does my diagnosis help us understand the problem? And is there anything objective that it's tied to? I think they would say, well, it helps us understand what medication is going to work best for you. And there's nothing objective tied to it. I would hope they'd say that. Objective, I mean, symptoms aren't really objective. They're subjective. But symptoms are utilized to, put you in a classification of a type of headache, which is the diagnosis. So, now there may be like one-off type scenarios where there is a maybe something objective that they're finding and connecting it to. I'd be fascinated to know what that looks like though. And I think it might just highlight, like, it might be your way of like asking a question and then showing them like actually you don't know like what you're doing. Well, that would be harsh, and you're definitely not going to say that. But that's essentially like just in a less harsh way. That's essentially what you're doing. You're asking them, is there anything objective tied to this, in a very kind way? And when they're like, well, not really, then it's like, okay, so how do you know like this medication is what I need? Well, not really. It's just like a trial thing. And so it's symptom management. Okay. I don't love just symptom management. Like, what else can I do to like help my body heal? Okay. So that's what we're getting at. And then lastly, if we start medication, what are strategies that the provider can suggest to reduce the need for medication? Okay. So if you just get medication after medication, say, this is fine. Like, I'm going to keep this, in my pocket, in my purse, whatever. I'll use it as needed. But what are strategies that I can put in place so that I don't have to, or that I can reduce my need for medication? Because I know that medication can even cause headaches, right? I don't want to take medication enough so that it causes me a headache. And so, again, we want to see them really try. I mean, this information is out there. I mean, they can even do like, half an hour search and come up with a decent list of things that can be done. And if they're a neurologist, if there's someone who's seeing headaches or migraines, they should definitely have something alternative to medication that they can provide. All right. So there you go. List of questions. And again, email hello@noveraheadachecenter.com. after you ask your providers, and I'd be fascinated to know what they say. Thank you all so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll give my voice a rest, and I'll see you guys next week. Thank you so much for listening.